Hello everybody here. First of all, I'd like to give you special thanks for coming today to my presentation conference and wish you a happy day here in Dubai. Okay? And give a special thanks to the organization committee for inviting me to this great event. I'm Dr. Mostafa Darwish. I'm lecturer of Pharmacology Toxicology in Nahda University. And my topic today will be about the chemotactic chemokine CX16 rule and its processing enzyme ADAM10 and ADAM17 and cell recruitment to the pancreatic beta cells and initiation of type 1 diabetes mellitus in mice and addition to modulatory action of Simvastatin in this action. Okay? Let's begin with a small intro about diabetes mellitus. As you know, it has a problem affecting worldwide and all individuals, about millions here. And statistically, by the beginning of the 21st century, there are about 150 million patients with diabetes mellitus. And according to the WHO expert, by 2025, this number will be doubled. So it's a big fraction in the worldwide. Okay? There is a chronic metabolic disorder, as you know, is affecting the pancreatic beta cells and accompanied by partial or complete decline in the insulin secretion, according to type 1 or type 2 diabetes mellitus. In our study, we're focusing on type 1 diabetes mellitus. It's an inflammatory disorder, and statistically, international integration of diabetes and atlas estimate that over more than 1 million children and adolescents will have type 1 diabetes mellitus in 2021. Okay? And type 1, as you know, is autoimmune disease characterized by a local inflammatory reaction in and around the islets, something called insulinitis. The inflammatory mediators and immune cells begin to attack the insulin-secreting cells in the pancreas, and followed by destruction of the insulin-secreting beta cells. There is many factors that may cause the inflammatory disorders and may cause type 1 diabetes mellitus. One of the most important results or causes is oxidative stress. That's an essential rule for this insulin secretion, destruction, beta cells. And also, recently, chemokines discovered that has a very important role, considered one of the main contributors in type 1 diabetes mellitus pathogenesis, causing immune system activation and attacking immune cells like T cells and macrophages. Martin et al. In 2007 discovered that there is many chemokines in the pancreatic beta cells, as you can see here in the figure, and we are focusing here on CX16. But they are not mentioning anything about the role of these chemokines. Just discovered these chemokines in the beta cells of type 1 diabetes mellitus. Despite scientific breakthrough during the past decades, expanded our knowledge regarding the pathophysiology and molecular mechanisms of type 1 diabetes mellitus, the molecular pathways beyond its detrimental events have yet to be illustrated, and there is still an unmet necessity to explore cell pathogenesis. So here we'll begin to focus on our study in the CX16. Why CX16 chemokine? CX16 is an exceptional chemokine that's found in two forms: soluble form in the blood and the membranous form in the cell membrane. Membranous form may act as a scavenger receptor bind to a molecule called oxidized LDL that begin to internalize into the cell and begin a sequence of oxidation and oxidative stress. Also, membranous one may act as adhesion molecule for the cells expressing CXCR6 like T cells and macrophages. Okay? That's the one membranous one. The other scenario was the other form of the CX16 is a soluble one, where it's cleaved by the ADAM10, ADAM17, the processing enzyme, and begin to be free and begin to attract the immune cells like T cells and macrophages. So it's a very exceptional one. So from this information, we hypothesize a theory that we want to investigate in our study. We hypothesize that beta cell pancreatic cell may have CX16 in the cell membrane outside. So in case, this first scenario, CX16 and cell membrane begin to internalize oxidized LDL inside the cell and begin to activate autophagy in the cell and the tissue factor release and exert stress. All of these parameters may eventually lead to the beta cell death. Okay? Also, the CX16 membranous one will begin to activate translocation of nucleofactor kappa B from the cytoplasm to the nucleus, and they will cause a positive feedback to upregulate the CX16 expression and increase this cycle. This is the first scenario. The second scenario of CX16 that may be processed by ADAM10 and ADAM17 enzymes. So make CX16 free and soluble and begin to attract the immune cells like macrophages and T cells to attack the beta cells and destroy and eventually cause the same result, beta cell death. So we have two scenarios here. Additionally, we begin to investigate the effect of simvastatin on all these aforementioned parameters. Why? Because it has anti-apoptotic effect, had antioxidant effect, and anti-inflammatory effect. Actually, we already proved the first scenario. We found that CX16 attached to the pathway of nucleofactor kappa B, P65, in the beta cells pancreas, and this paper is published in Life Science, Factor 6.7. Another pathway, we found the tissue factor activation release in pancreatic beta cells after the activation of CX16 and oxidized release pathway in the pancreatic beta cells. And this one published in the European Journal of Pharmacology, Factor 4.5. So we want to focus here in our study on the second scenario, the soluble form CX16. So the aim of our study is studying the protective effect of simvastatin regarding CX16 suppression and its processing enzyme, the ADAM10 and ADAM17 that make it soluble form in the diabetic mice type 1. And to fulfill this process, we used animals called sea mice, adult male, weighing from 25 to 30 grams, and all the chemicals used in high electrical grade. We allocated the groups to 4 groups. First group, and normal, taken just the vehicles in buffer, and the second simvastatin just to check the safety of the simvastatin. Third group, taken STZ, the cetirizine, to 55 milligram per kilogram intraperitoneally for 5 consecutive days. And this model. And group 4 combination between the STZ and simvastatin to see objective results. Our results here, just to be sure that we have achieved the type 1 diabetes in the mice, we checked all these parameters: body weight, blood glucose, serum insulin, and blood profile. And we found that diabetic mice profoundly decreased body weight and the insulin serum insulin, and decreased the blood glucose and liver profile, like the cholesterol and triglycerides. And after giving simvastatin, they significantly decreased and improved all these aforementioned parameters. Also, we're talking about type 1 diabetes, inflammation. So we have to detect the inflammation process, like TNF-alpha, white blood cells count, and serum nitric oxide. And when we found that the diabetic mice increased all these parameters, and after giving simvastatin, they restored all these parameters nearly almost to the normal levels. So the most important part here is detecting the CX16 in the cell or outside the cell. So we use a technique to visualize these proteins that's called the immunofluorescence technique. We are an expert in this technique and begin to stain this protein in the cell. We made here double staining, as you know, the immunofluorescence. Immunofluorescence, depending on putting secondary antibody, we have fluorescence. Maybe green, like Alexa-Fluor, or maybe red, COS3, just to differentiate between the proteins inside the cell. We stain the insulin Y to detect the beta cells. It's the only cell secreting insulin. So I have to stain this type of cells. And the other stain is CX16. That's my protein I want to detect. And we found that if they are found already in the diabetic mice. And you can see normal, there is no expression of 616. After giving STZAP, profoundly suppressed here. After giving simvastatin, normally increased to the normal level or basic level. Okay. Also, using ELISA, we detect the serum level of CX16. And we found that diabetic mice really have a high level of soluble the soluble 616 and decreased by the simvastatin. That's the first evidence. Now I detect the 616. I want to know that it will be cleaved by a processing enzyme or not. So I begin to detect the ADAM10, ADAM17, the processing enzyme of this protein. And can you see here, diabetic mice, we detect there is many cells inside the beta cell that expressing the ADAM10. Okay, and also here, many cells localized here having the ADAM17. So it's expressed also in the cells, in the beta cells. To be more sure, we isolated the beta cells and make Western blot to be sure that ADAM10 really expressed in these cells. And we found it really highly upregulated in the diabetic mice and decreased after given simvastatin. So now I have two information, 616 expressed and ADAM10 and ADAM17. What the next step will be? I'm talking about inflammation, type 1 diabetes mellitus. So I want to check the T cells, immune cells, where they are now. We took a picture in two sides at the same time. A picture to pancreas, to see the filtration, and the picture to the spleen, to see the immune cells where. And we here can see the diabetic mice, the profound, many T cells are found inside the beta cells. There's infiltration. Okay, normal distribution here, and after giving simvastatin, the fluorescence decreased to the almost normal level. At the same time, taking a picture to the spleen. In diabetic mice, we see the decrease in the regulation and number of the T cells in the spleen. What's the meaning of that? Meaning of that all these cells migrate from the spleen to attack the pancreas and begin to infiltrate the pancreatic beta cells. This is one of important mechanisms of the type 1 diabetes mellitus. As I have mentioned the mechanism, eventually beta cell destruction and death. So we have assessment of the apoptosis by using tunnel assay and caspase-3 regulation in the Western blot. And we can see here in the diabetic mice, there is many apoptosis, apoptotic cells by tunnel assay, positive cells, and in Western blot, have regulation of caspase-3 in diabetic mice and decrease after giving the simvastatin. So conclusion and our recommendations. 616 might act as a soluble, not also membranous, chemotactic, chemokine inducing pancreatic T cells recruitment and infiltration after a cleave by the processing enzyme ADAM10 and ADAM17. Targeting 616, ADAM10 and 17 might offer a new attractive strategy to prevent pancreatic beta cell infiltration and death, and 6-driven T cell recruitment in type 1 diabetes mellitus. Simvastatin improved type 1 diabetes mellitus not only by its redox decreasing blood status, but also by attenuation of metabolic disorder and also mitigation of pancreatic beta cell apoptosis and recruitment of the T cells. Simvastatin could be a promising adjuvant therapy in treating diabetic patients, and further clinical studies are required to be sure that's a correct theory. Finally, give special thanks to my research team, and I'm one of them for making this study. And special thanks to Dr. Muhammad Sadiq, the head of our team, he is a pioneer of immunofluorescence technique in Egypt, and first one had talk about the 16 rule, the kidney disease, like glomerulitis and the other diseases. So I have an honor to share with him and may know in diabetes mellitus the process of the 16. Finally, thank you for attention, and any question, I welcome them. Thank you.
Thank you, Doctor. Anybody? Yes, we've got one.
Sorry, I didn't follow your story, but what is the simvastatin? Is it protein or something?
Simvastatin is a drug. Drug and drug.
Drug, I see, I see.
Yeah, there's a lipid lowering drug.
Oh, I see, thank you.
Yeah.
And a lot of people have problems with it. Me being one.
Interesting.
Yeah, yeah. I mean, it is one of the antilipids that is known, and there's further research being done on it at the moment about the highlight of backache and joint problems that it gives. Doesn't affect everybody, but certain people it does. I can share a bit mine. I couldn't even put one foot in front of the other. That's how ill I was with Simvastatin.
It can cause myopathies.
Yeah.
Myopathies sometimes.
Yes.
Myositis.
Yeah.
Yeah,
I've got no
side
other
effects,
normal
yeah.
problems with diabetes, so I'm a very rare creature. Because diabetes actually got 7 categories. Type 1 diabetes, yeah.
Yeah.
And I sit in category 7, caused from a virus
Yeah.
that totally
Type
wiped out
1
my
diabetes.
pancreatic
Yeah.
function.
That's true.
So I'm a very unique diabetic. So
You should do research on it.
yeah, probably, yeah. No, I'm not putting myself in physical unique, but I find it really fascinating
Thank
to
you.
look at something that way.
Thank you.
So,
Thank you so much.
no further questions? Oh yes, one more, hang on.
I have a question regarding the recent vaccination effects on diabetes. Have you seen any rise in pre-diabetic cases or borderline diabetic cases after the vaccination?
Actually, till now, I didn't see any case taking vaccination and proceed well. Yes. I know this type 1 is genetic also.
Yeah.
You know, the parents, if they have type 1 diabetes or the family history, more than 9%, 95%, the child will have this disease. Unfortunately.
I think there's a lot of research that's required in this field.
Yeah, a lot of
Thank you.
research. Thank you.
Especially now, because in my practice in functional medicine and functional nutrition, I find that people after the post-vaccine they are having a lot of insulin resistance already. And,
Resistance?
Insulin resistance, yes.
Yeah.
Insulin resistance.
Insulin resistance.
Yeah.
Type 2 diabetes, not type 1.
Type
Type 2, there's insulin release normal, but the cells don't respond to the insulin.
Yeah.
Insulin resistance.
So thank God, like the children were not vaccinated on a global scale, so we kind of may not have that adverse effect. Thank you, thank you.
Thank you. Thank you.
Thank you.
Thank you.